Hello, my name is Nehal Desai, and I'm going to quickly talk about the SigCodes. Typically, whenever a doctor hands you a script, or whenever you get a prescription electronically, or even when you're in community pharmacy setting where a patient drops off a script at the drop-off window, um, you may need to do some data entry. In this case, you're going to need to understand some basic SIG codes so that you understand what's written on the prescription. Um, so, or whenever a doctor calls in a script over the phone, you have to understand what they are saying, and or you have to write it very quickly. These are the ways to um, do it. So you would need to understand SIG codes, whether you're translating directions from the doctor or whether you're trying to transcribe what the doctor is saying over the phone to make um, the directions very quick. So let's go over these SIG codes and see what um, ways to remember them. So this first one is not bad. It's just talking about a general timing to take the medication or drug. Um, you will see SIG codes like this, and there might be other SIG codes that are not listed in this presentation. Um, but you can let me know, and I will have an updated slide set for you whenever I get that information. So in this first slide here, you can see the general timing to take the medication or drug. First one here listed as AC before meals. I think of AC as like AM. It's the first thing in the morning, and it's like having before breakfast. So AC before meals, PC past um, time to chow or past chow time, AM like, you know, AM chow time, or you can think of it different ways here. But technically, AC and PC, AC is before meals, PC is after meals. And then the next couple ones here are like BID, meaning twice a day, or you can take BI as bi-daily, twice daily, or TID as 3 times a day, or you can just make it up, 3 daily, or yeah. So just kind of finding ways to help you remember these basic SIG codes here. QAD is 4 times a day. Quad daily, I guess you can remember it as. QHS, at bedtime. You might even see a SIG code as HS, which is also going to be at bedtime. So just note that. I guess uh, or it's kind of like I'm just trying to think of a way to help you remember it. Um, so HS, you'll just have to know HS at bedtime. Um, there might be other ways you might be able to remember it, but this is what it is. QAM every morning, QPM every evening, QD daily, or once daily, and then QOD every other day. So these are very straightforward. You should be able to know how these SIG codes are written. You should know how to write them. You should know how to translate them into actual meaning. So hopefully you'll be able to get through that step. This next one is about the specific timings to take the drug. Like, is it every hour, every 4 hours, every 6 hours, every 8 hours, every 12 hours? So that's what QH every hour, Q4H every 4 hours, Q6H every 6 hours, Q8H every 8 hours, Q12H every 12 hours. So these are very, very easy SIG codes. I don't think you all should have any issues here. So just know that. The next one are the different routes of administrations. How should a patient take the medication? Should they take it by mouth? Should they take it, as an injection? Those kinds of things. Because as a pharmacist and even some of the pharmacy technicians out there, you may be needed to or required to vaccinate patients, and the directions for typing of the prescription might list it as IM or SQ, so you would have to know that. So here I have listed a table here for your reference. PO is by mouth, sublingual, under the tongue. IM into a muscle, IV into a vein, PR rectally, PV vaginally, TOP topically or on the skin or affected area. You might also see AAA applied to affected area. INH, inhalation, SC, SQ, and sub-Q are all under the skin. ID as into the skin. OD as right eye. OS left eye. And then OU each eye. And then instead of O, you just replace it with A. So it'll be AD right eye, AD right ear, AS left ear, AU each ear. So just get familiar with these types of SIG codes because you may be required to use these in practice. And so it's very important to understand this listing of SIG codes, especially that since these are the routes of administrations. This is explaining how the patient should take the medication. So many times the computer systems will have SIG codes automatically typed up into written directions. It just varies between the updates and the different computer softwares. But at least having this basic understanding of SIG codes will go a long way in making life easier when, writing out directions that the doctor gives over the phone, or whenever you're looking at a prescription and trying to understand what the directions are stating. So these tables should be useful to you whenever you come across any of these types of SIG codes. Again, this is not an all-inclusive list. There are probably other types of SIG codes that have not yet been included in this presentation. So whenever any of you have the time and want to and have any updated SIG code information, please feel free to add it as a comment on this YouTube page, or feel free to let us know on our Facebook page, on Farmsurance page, so that we can have an update list for everyone else out there that is trying to understand the basic SIG codes and the definitions for their practice as well. So the next thing here I have are the dosage form SIGs. These aren't very complicated. These are just explaining the type of medications that patients might be taking. So like tablet would essentially be the first three letters here: TAB, capsule, CAP, GTT. Now, this is a very unique type of SIG you probably may or may not encounter in practice. It is very important to know GTT as drop. Sometimes the SIG or the directions might write one GTT OU. So like one drop in each eye, and then write QD once daily. So you have to know the SIG here, GTT. The rest is pretty much self-explanatory. SUPP, suppository; SUSP, suspension; solution; syrup; elixir; ointment; cream; gel; patch; and nebulizer solution. So these are other types of SIG code and its definition listed here. The next one here are the measurement SIGs, like milligrams, micrograms. There's two definitions of micrograms here. You got mcg, and then you got this symbol and like a U mu type of symbol, and a G, so that's a microgram as well. Do not really recommend. I do not think it's recommended to use this other microgram SIG, as it can lead to medication errors according to the ISMP, Institute of Safe Medication Practices. However, sometimes doctors still use it, so it is a good idea to understand this SIG as well. And then the next ones here are very simple. You can see here gram, kilogram, milliliter, liter, teaspoon, tablespoon. I do want you to understand the amounts in a teaspoon and tablespoon. One teaspoon consists of approximately 15 or 5 milliliter, and 1 tablespoon contains approximately 15 milliliters. So make note of that. Ounce, definitely understanding ounces as well. 1 fluid ounce is approximately 30 milliliters, so at least taking that into consideration. Then cubic centimeter, which 1 cubic centimeter is approximately 1 milliliter. Then you got unit and international unit. These I haven't really seen them as much error-prone abbreviations. I think one of these is not recommended per the ISMP guidelines. However, sometimes it's still used in practice. But pay attention to this unit. A lot of times you'll get a prescription regarding an insulin medication, and you need to understand units here. So note that. And then QTY is quantity, and then QS is sufficient quantity. Then the next ones here are the special SIG types and considerations, like APAP, acetaminophen, OTC over the counter, NPL meaning nothing by mouth. Then 1 teaspoon, I already told you this earlier, 1 teaspoon is 5 milliliter, 1 tablespoon 15 milliliters, CC is like 1 milliliter, and 20 drops is approximately 1 milliliter. So make sure you know that. Some of you may have seeing it as 15 ml, 15 drops as 1 ml. Now, I think that's mostly in like a hospital setting, but in like community settings, typically it's 20 drops per ml. So, but if anyone has any um, questions, or if anyone wants to add anything to that, feel free to comment it on our page. And if any of you have any questions or would like to add any additional comments, please feel free to let us know either on our YouTube channel, on our Farm Bits YouTube channel, or on our Farm Insurance page, or our Netflix review group page. Again, I think you all should be familiar with all of these SigCodes. Some of these might even be on your exams, so make sure you're all aware of that. I hope this has been a helpful resource to you all, and I hope you all have a good day. But thank you for watching, and I'll see you later.